Greetings, everyone. For today's lecture, we're going to learn more about the fundamentals of nursing. Unit 1, The Nature of Nursing. Chapter 1, Historical and Contemporary Nursing Practice. And for this lecture, we're going to focus on the different nursing organizations. This book from Kushner and Erb will be our main reference. Okay, so we're discussing about nursing organizations, but we previously discussed about the different nursing associations. What are the difference between them? The main difference between an organization and an association is that an organization is a group of people within within a company who perform a specific function or role. On the other hand, an association is a group of people who have a common interest that brings them together for a particular purpose. As nursing has developed, an increasing number of nursing organizations have formed. These organizations are at the local, state, national, and international levels. Okay, the organizations that involve most American nurses are the ANA, or American Nurses Association, the NLN, or the National League for Nursing, the ICN, or the International Council of Nurses, the NSNA, or the National Student Nurses Association, and the STT, or the Sigma Theta Tau. The number of nursing specialty organizations is also increasing. For example, the Academy of Medical Surgical Nursing, American Association of Nurse Anesthetists, National Black Nurses Association, and National Association of Pediatric Nurse Practitioners. For this lecture, we're going to focus on the nursing organizations. Participation in the activities of nursing associations enhances the growth of involved individuals and help nurses collectively influence policies affecting nursing practice. The first that we're going to tackle about is American Nurses Association. The ANA is a national professional organization for nursing in the United States. It was founded in 1896 as the Nurses Associated Alumni of the United States. In 1911, the name was changed to the American Nurses Association. It was a charter member of the International Council of Nurses, along with organizations in Great Britain and Germany in 1899. The purposes of the ANA are to foster high standards of nursing practice and to promote the educational and professional advancement of nurses so that all people may have better nursing care. In 1982, the organization became a federation of state nurses associations. Individuals participate in the ANA by joining their state nurses association. The official journal of the ANA is the American Nurse Today, and the American Nurse is their official newspaper. This is their website, and this is their introduction in the website given. The American Nurses Association is the premier organization representing the interests of the nation's 4 million registered nurses. ANA is at the forefront of improving the quality of healthcare for all. Founded in 1896 and with the members in all 50 states and U.S. territories, ANA is the strongest voice for the profession. They also included here their goals to advance the nursing profession. ANA assists advancing the nursing profession by fostering high standards of nursing practice, promoting a safe and ethical work environment, bolstering the health and wellness of nurses, and advocating on healthcare issues that affect nurses and the public. Because ANA represents the interests of all registered nurses, we are here to support you to reach your full potential, from career development resources to lobbying Congress on the issues that affect nurses. We are here every step of the way. When individual nurses achieve their full potential and unite with others, ANA can accomplish its mission, which is to lead the profession to shape the future of nursing and healthcare. Next is the National League for Nursing. The NLN, formed in 1952, is an organization of both individuals and agencies. Its objective is to foster the development and improvement of all nursing services and nursing education. People who are not nurses but have an interest in nursing services, for example, hospital administrators, can be members of the League. This feature of the NLN involving non-nurse members, consumers, and nurses from all levels of practice is unique. The NLN presents continuing education workshops and seminars for its members. For schools of nursing, the NLN offers testing services, including pre-admission testing for potential students and achievement testing throughout the program. The NLN also conducts yearly surveys of nursing schools, newly registered nurses, and post-basic graduates. These surveys serve as a primary source of research data about nursing education in the United States. The ACEN, or the Accreditation Commission for Education in Nursing, formerly NLNAC, is an independent body within the NLN which provides voluntary accreditation for educational programs in nursing. The official journal of the NLN is called Nursing and Healthcare Perspectives, and this is their website. And in this website, this is their introduction. NLN is dedicated to excellence in nursing, and it is a premier organization for nurse faculty and leaders in nursing education. The NLN offers professional development, networking opportunities, assessment services, nursing research grants, and public policy initiatives to its nearly 45,000 individual and 1,100 institutional members. NLN members represent nursing education programs across a spectrum of higher education, healthcare organizations, and agencies. Founded in 1893, the American Society of Superintendents of Training Schools for Nurses, the NLN was the first nursing organization in the United States, headquartered in Washington, D.C. The NLN is led by a board of governors elected at large with a membership for 3-year terms. The volunteer board chair works closely with the NLN's president and chief executive officer. Next is the International Council of Nurses, or the ICN. ICN was established in 1899. Nurses from Great Britain, the United States, and Canada were among the founding members. The Council is a federation of national nurses associations such as the ANA and CNA, or the Canadian Nurses Association. The ICN provides an organization through which member national associations can work together for the mission of representing nursing worldwide, advancing the profession, and influencing health policy. The 5 core values of the ICN are visionary leadership, inclusiveness, innovativeness, partnership, and transparency. The official journal of the ICN is called International Nursing Review, and this is their website. You can remember the core values of ICN with the acronym VIPIT, or VIPIT. And this is their introduction in their website. The ICN is a federation of more than 130 national nurses associations, representing the more than 27 million nurses worldwide. Founded in 1899, ICN is the world's first and widest-reaching international organization for health professionals. Operated by nurses and leading nurses internationally, ICN works to ensure quality nursing care for all, sound health policies globally, the advancement of nursing knowledge, and the presence worldwide of a respected nursing profession and a competent and satisfied nursing workforce. ICN's ever-increasing networks and connections to people reinforce the importance of strong linkages with national, regional, and international nursing and non-nursing organizations. Building positive relationships internationally helps position ICN, nurses and nursing for now and the future. Our work with the specialized agencies of the United Nations system, particularly with the World Health Organization, the International Labour Organization, and the World Bank, are important for nurses everywhere. In addition, we work closely with a range of international non-governmental organizations and other partners. Next is the National Student Nurses Association. The NSNA is the official pre-professional organization for nursing students. It was formed in 1953 and incorporated in 1959. The NSNA originally functioned under the aegis of the ANA and NLN. However, in 1968, the NSNA became an autonomous body, although it communicates with the NLN and ANA. To qualify for membership in the NSNA, a student must be enrolled in a state-approved nursing education program. The official journal of the NSNA is Imprint Magazine. And this is their website, and in this website is their introduction. NSNA's mission is to mentor students preparing for initial licensure as registered nurses, and to convey the standards, ethics, and skills that students will need as responsible and accountable leaders and members of the profession. Founded in 1952, the NSNA is a non-profit organization for students enrolled in associate, baccalaureate, diploma, and generic graduate nursing programs. It is dedicated to fostering the professional development of nursing students. The organization has 60,000 members in 50 states, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands. Its board of directors is made up of 9 nursing students who are elected at the organization's annual convention and 1 ex-official board member elected by the Council of State Presidents. 2 non-voting consultants are appointed by the American Nurses Association and the National League for Nurses to provide guidance. NSNA also employs a full-time staff headquartered in Brooklyn, New York. Over 3,000 nursing students participate in NSNA's annual convention, which features leadership and career development activities, opportunities to listen to renowned nursing leaders, hear about job opportunities, and a chance to network with hundreds of other students. The program includes a state board exam mini review. NSNA holds a second meeting which attracts over 1,500 students yearly. The mid-year conference offers workshops and panels on career and association development, as well as the state board exam mini review. The foundation of the NSNA, created in memory of NSNA's first executive director, Francis Tompkins, is a nonprofit corporation organized exclusively for charitable and educational purposes. The FNSNA has distributed over $4.2 million in scholarships for undergraduate nursing education. The Promise of Nursing Regional Scholarship Program, administered by the FNSNA, provides undergraduate and graduate nursing scholarships and school grants. Its official magazine imprint publishes 5 times during the academic year, and members are notified of publication and provided access link via email. And lastly is the International Honor Society called Sigma Theta Tau. Sigma Theta Tau, the International Honor Society in Nursing, was founded in 1922 and is headquartered in Indianapolis, Indiana. The Greek letters stand for the Greek words storga, charos, and thema, meaning love, courage, and honor. The society is a member of the Association of College Honor Societies. The society's purpose is professional rather than social. Membership is attained through academic achievement, and students in baccalaureate programs in nursing and nurses in master's, doctoral, and postdoctoral programs are eligible to be selected for membership. Potential members who hold a minimum of a bachelor's degree and have demonstrated achievement in nursing can apply for membership as a nurse leader in the community. The official journal of the Sigma Theta Tau, the Journal of Nursing Scholarship, is published quarterly. The journal publishes scholarly articles of interest to nurses. The society also publishes Reflections, a quarterly newsletter that provides information about the organization and its various chapters. This is their official website, and this is their introduction in it. In 1922, 6 nurses founded Sigma Theta Tau International Honor Society of Nursing, today known as Sigma, the Indiana University Training School for Nurses, which is now the Indiana University School of Nursing, in Indianapolis, Indiana, USA. The founders chose the name from the Greek words Storge, Taros, and Time, meaning love, courage, and honor. Sigma became incorporated in 1985 and is a non-profit organization with a 501 tax status in the United States. Their vision is connected, empowered nurse leaders transforming global healthcare. Their mission is developing nurse leaders everywhere to improve healthcare everywhere, and their strategic goals include the Sigma Board of Directors has determined 4 strategic goals and guide the organization, including grow in value for nurses globally, recognize and promote nursing scholarship, leadership, and service, expand and develop strategic relationships globally, and advance innovative and customized resources to develop nurse leaders. Potential members who meet our eligibility criteria are invited to join Sigma, baccalaureate, and graduate nursing students who demonstrate excellence in scholarship, and to nurse leaders exhibiting exceptional achievements in nursing. So I have here a diagram on how you can understand them better. Nursing organizations include ANA, or the American Nurses Association. They are the one who fosters high standards for nursing practice. The NLN, or National League for Nurses, are the developers of nursing. They provide programs to ensure that nursing education and nursing practice is being developed. The ICN, or the International Council of Nurses, are our representatives globally and in different organizations worldwide. The NSNA are our students, and the STT, or Sigma Theta Tau, are for our nursing scholars. As a summary, we discussed about the different nursing organizations. The ANA, and their journal is called American Nurse Today, and their newsletter is called The American Nurse. The NLN, which includes the ECEN, or their accreditations, and their journal is called Nursing and Healthcare Perspectives. We'll discuss also about the ICN, or International Council of Nurses. Their journal is called International Nursing Review, and their core values include VIPIT, or Visionary Leadership, Inclusiveness, Partnership, Innovativeness, and Transparency. The NSNA, or the National Student Nurses Association, and their journal called Imprint. The Sigma Theta Tau, the Journal of Nursing Scholar, and their newsletter is called Reflections. You can also remember this diagram in order to know their roles and responsibilities as organizations. The ANA are those that foster high standards. The NLN are our developers. ICN are our representatives. SNA are composed of students, and SAT are nursing scholars. And also, these are the different specialty organizations. And on the next video, we'll discuss about the Chapter 2, Evidence-Based Practice and Research in Nursing.